Sleeping sickness is a serious disease. It affects people and animals in Africa. The disease is caused by a parasite. The parasite is called trypanosoma. Tsetse flies spread the parasite. These flies are only found in rural Africa. There are two main types of sleeping sickness. One type is acute. It progresses quickly. The other type is chronic. It develops slowly over time. Both types are dangerous. They can be fatal if left untreated. Sleeping sickness is a major public health concern. It affects millions of people. The disease can cause serious neurological problems. It can lead to death. We need to raise awareness. We need to find effective treatments for sleeping sickness. There are two main forms of sleeping sickness. They are caused by different subspecies of the trypanosoma parasite. Each form has a different geographic distribution and clinical presentation. Trypanosomiasis gambiense is the most common form. It is found in West and Central Africa. This form accounts for the majority of cases. It causes a chronic infection. Symptoms may not appear for months or even years. Trypanosomiasis rhodesiense is less common. It is found in East and Southern Africa. This form causes an acute infection. Symptoms appear within weeks. The disease progresses rapidly. Both forms of sleeping sickness are serious. They require prompt diagnosis and treatment. Early detection is crucial for a positive outcome. Sleeping sickness is characterized by a range of symptoms that can be quite varied and sometimes confusing. These symptoms can vary significantly depending on the stage of the disease, making it crucial to understand the progression. Early diagnosis and prompt treatment are essential to managing the disease effectively. They can prevent serious complications and improve the chances of a full recovery. In the early stages, symptoms are often mild and nonspecific, which can make them easy to overlook. These early symptoms can resemble those of other common illnesses, such as the flu or a cold. Common early symptoms may include fever, persistent headaches, and swollen lymph nodes, which can be mistaken for other conditions. Other early signs to watch for are joint pain, muscle aches, and itching, which can also be misleading. As the disease progresses, the parasite crosses the blood-brain barrier, leading to more severe symptoms. This can result in neurological and psychiatric symptoms that are more difficult to treat. These advanced symptoms include confusion, significant personality changes, and severe sleep disturbances. It's important to seek medical attention as soon as any symptoms are noticed. This is especially important if you have traveled to areas where the disease is known to be present, such as certain parts of Africa. Early diagnosis and treatment can be life-saving, making awareness and prompt action critical. Sleeping sickness gets its name from a distinct symptom. In the late stage, people experience severe sleep cycle disruptions. They may sleep excessively during the day. They may have insomnia at night. As the parasite invades the central nervous system, more neurological problems arise. These include progressive confusion and mental deterioration, difficulty walking and coordinating movements, tremors, seizures, and paralysis. If left untreated, sleeping sickness is fatal. The late-stage complications are severe. They lead to coma and death. The time from onset to death can vary. It depends on factors like the parasite subspecies and individual immune response. Section 5. Diagnosis. Unveiling the hidden enemy. In this section, we delve into the critical process of diagnosing sleeping sickness, a disease that can be fatal if not detected and treated in time. Diagnosing sleeping sickness is crucial for timely treatment. Early detection can significantly improve the chances of recovery and prevent severe complications. The methods involve identifying the parasite. This is done through various laboratory tests that are designed to detect the presence of trypanosoma parasites in the blood. Doctors also look for specific antibodies in the blood or other bodily fluids. These antibodies are produced by the immune system in response to the infection. The first step usually involves a physical exam. This helps the doctor to identify any visible signs of the disease. The doctor will check for swollen lymph nodes. Swollen lymph nodes are a common symptom of sleeping sickness and can provide an early indication of the disease. They will ask about the patient's medical history. Understanding the patient's medical background can help in identifying potential risk factors and previous exposures. They will want to know about any travel to endemic areas. Travel history is crucial as sleeping sickness is prevalent in certain regions, particularly in sub-Saharan Africa. Blood tests are essential for diagnosis. These tests can detect the presence of the parasite in the bloodstream, which is a definitive indicator of the disease. They can detect the parasite in the blood. the microscopic examination of blood samples is a key diagnostic tool. Microscopic examination of blood samples can reveal the presence of trypanosomes. These parasites are the causative agents of sleeping sickness. In advanced stages, a lumbar puncture may be necessary. This procedure involves collecting cerebrospinal fluid to check for the presence of the parasite. This procedure collects cerebrospinal fluid. The fluid is then analyzed in the lab to detect the parasite and assess the extent of the infection. Doctors examine the fluid for the parasite. They also look for other signs of infection that may indicate the progression of the disease. They also look for signs of infection. Identifying these signs early can help in managing the disease more effectively. Early and accurate diagnosis is vital. It allows healthcare providers to start treatment promptly, which can prevent the disease from advancing to more severe stages. It allows for prompt treatment. Early treatment can significantly improve the patient's prognosis and reduce the risk of long-term complications. It improves the chances of a positive outcome. With timely diagnosis and appropriate treatment, patients can recover fully and return to their normal lives. Section 6. Treatment: Battling the parasite. This section delves into the various treatment strategies employed to combat the deadly sleeping sickness, a disease caused by the trypanosoma parasite. Treatment for sleeping sickness depends on the stage of the disease. Early detection is crucial for effective management and better outcomes. It also depends on the specific subspecies of the parasite involved. Identifying the exact type of parasite is essential for choosing the right treatment plan. The medications used can have serious side effects. Patients often experience a range of adverse reactions, which can complicate the treatment process. Close monitoring by healthcare professionals is essential. Regular checkups and monitoring help in managing these side effects effectively. For early-stage trypanosomiasis gambiense, the medications pentamidine and suramin are effective. These drugs are administered under strict medical supervision. These drugs work by killing the parasite in the blood and lymph. They target the parasite at its initial stages, preventing further spread. For late-stage trypanosomiasis gambiense, when the parasite has invaded the central nervous system, eflornithine and nifurtimox are used. These medications are more potent and are administered intravenously. These drugs are more effective in crossing the blood-brain barrier. This is crucial for treating the parasite that has reached the brain and spinal cord. Treatment for trypanosomiasis rhodesiense is more limited. The options available are fewer, making it a more challenging condition to treat. Suramin is the primary drug used for both early and late stages. It is one of the few effective treatments available for this subspecies. However, it can have significant side effects. Treatment can be complex and requires a tailored approach for each patient. It requires careful management by experienced healthcare providers. A multidisciplinary team approach is often necessary to handle the complexities of the disease and its treatment. Section 7. Prevention: Protecting yourself from the tsetse fly. Preventing sleeping sickness primarily involves avoiding tsetse fly bites. These flies are found in rural areas, particularly near water sources. Wearing protective clothing can reduce the risk of bites. Long sleeves and pants, light colors, and insect repellent are all effective measures. Tsetse fly traps can be used to control fly populations. These traps use insecticides or attractants to lure and kill the flies. Community-based vector control programs are crucial. These programs involve clearing vegetation near homes. They also involve using insecticides in areas where flies breed. By reducing exposure to tsetse flies, we can significantly lower the risk of sleeping sickness. Section 8. The socioeconomic burden of sleeping sickness. Sleeping sickness has significant socioeconomic impacts. It primarily affects poor and rural communities in sub-Saharan Africa. This disease traps families in a cycle of poverty. The disease leads to decreased productivity. People who are sick cannot work. It also places a strain on healthcare systems. Treatment is expensive and often inaccessible in remote areas. The stigma associated with sleeping sickness can lead to social isolation. This can prevent people from seeking treatment. The economic burden of sleeping sickness extends beyond the individual level. It affects national development. It hinders economic growth. Section 9. Global efforts in disease control. International organizations, governments, and research institutions are working together. They aim to control and eventually eliminate sleeping sickness. the World Health Organization plays a leading role. It provides technical assistance, it supports disease surveillance, it helps with access to treatments. Research is ongoing. Scientists are developing new diagnostic tools. They are also working on more effective and less toxic treatments. Vector control strategies are also being improved. Despite these efforts, challenges remain. Funding for sleeping sickness control is limited. More resources are needed. We need to strengthen healthcare systems. We need to improve access to care in remote areas. Section 10. The importance of community education. Community education is crucial for sleeping sickness control. It empowers individuals. It promotes early detection. It encourages preventive measures. Educational campaigns can raise awareness. They can teach people about the symptoms of the disease. They can explain how to prevent tsetse fly bites. Community health workers can play a vital role. They can provide information and support. They can help with early diagnosis. They can refer people for treatment. By engaging communities, we can break down stigma. We can encourage early treatment-seeking behavior. We can reduce the burden of this devastating disease. Section 11. Conclusion. A call to action. Sleeping sickness is a neglected tropical disease. It has devastating consequences, but it is preventable and treatable. We need to increase awareness. We need more research. We need to strengthen healthcare systems in endemic areas. By working together, we can control and eventually eliminate sleeping sickness. We can improve the lives of millions of people in Africa. Let's work towards a future free from this silent killer.